Hi, I'm Shauna Williams. I'm the owner of SW Doula LLC. I'm a licensed clinical social worker, a doula, and a certified lactation counselor. Today I'll be talking about labor positions and movement. I've broken this presentation down into multiple parts. In part one, we'll be talking about the stages of labor, knowing what to expect and how to respond to what happens in pre-labor, what to do if your water breaks, and you'll know when it's time to head to the hospital. So the stages of labor are broken down into two stages. The first is the ripening of the cervix. So this is pre-labor, early labor, sometimes called the latent phase, the active labor stage or phase, and transition. The second stage is when we're pushing out baby. So this is the resting phase, the descent, crowning, and birth of your baby. So we're going to focus on pre-labor. What is pre-labor? This is when your cervix is ripening, it's effacing or thinning out, and it's moving forward. You're having contractions, but they're not changing much, and the frequency is kind of all over the place. For a while, it might seem like it's staying at the same rate, and then it might be a long space of time in between them. They're not progressing. Also, you might be feeling some restless backache. You might have soft bowel movements and menstrual-like cramps. The person who is pregnant is going to feel tired during this phase, perhaps. They might feel a little discouraged or anxious if this period is long or painful. Sometimes folks get so focused on what's happening in their body during this phase that they overestimate their progress and they start rituals, or these are natural behaviors that people start to do when they are coping with the sensations of labor. They might go to the hospital too early. This is when someone will go to the hospital and they'll tell you, oh, the hospital sent me back home. That's because it's kind of an overreaction to what's happening in the body because the birthing person is so focused on the contractions. Or the birthing couple sometimes they're both focused on those reactions or those sensations in the body. So things that a partner or support person can do or say during this time period is to try to distract the birthing person as much as possible. Maybe go outdoors or work on a project together. You could bake or knit or do yard work. If it's possible to have a friend or family member come over. These are activities that can be distracting. You could also watch movies that you like together. Some people actually go out to eat during this time period. They do anything that can distract them and keep their focus off of just what's happening in their body. But it's also good to balance this with activities of rest. So alternating that with distraction. And those activities could be maybe taking a bath, listening to music, lying down, getting a massage, or being in a dark room. If you feel some pressure to move things along, you could try some labor stimulating measures, which are different behaviors that folks might engage in to try to naturally help the body move along. But there's really no need to do this. This is only if you're feeling pressure to get into the labor process. The support person should do whatever's necessary to accomplish the above. That might mean encouraging the person to eat or drink. They don't have to have a huge meal or drink a certain amount, but if they're hungry, eat. If they're thirsty, drink. Particularly during a hospital birth, you're not going to be able to go to the hospital and be there very long before they tell you you're not going to be allowed to eat or drink. So to go ahead and do that during pre-labor is important. You're going to start timing the contractions, 4 or 5 of them that are in a row. Every few hours you'll do that, or when you notice that something seems to have changed in the way that labor feels. Don't leave the birthing person alone. They really need emotional support and they need your help to stay distracted or engaged. I've seen partners sometimes say, okay, well, I'm heading to work. It's probably not a good idea, or you can try to find another person like your doula or a family friend to come and spend some time with that person or call and check in pretty regularly with that person because they really should not be left alone. And help folks maintain normal activity as much as possible. Some movements that can be helpful during this stage with helping things move along and also with just distracting or being good for the body include walking. Standing and walking together as a birthing couple takes advantage of gravity in encouraging descent of the baby. Showering. Directing the shower against the low back can really help a lot with lower back pain. Baths are very relaxing. And when you're in the bath, you should make sure that it's a submerged bath so that it's really around that, covering that lower back portion of the body and really helping with back pain. Swaying back and forth on the birth ball can be really helpful with opening the pelvis. And slow dancing, standing and swaying side to side, being embraced by your partner, can really help. This encourages not just descent of the baby into the pelvis and help manage those feelings of contraction, but also it can be helpful with increasing oxytocin, which is a body hormone that helps labor move along. Pelvis rocking is a great technique to do during pre-labor. This is when the birthing person would get on their hands and knees, and while kneeling and leaning forward, they're going to rock their pelvis forward and back, similar to the cat-cow pose in yoga. As you can see in this lower picture, the person's upper back is pretty high up in the air. Or they might rotate their pelvis in a circle. This helps kind of dislodge the baby if the baby's in a little bit of an awkward position, and it encourages rotation of the baby that naturally would happen. And this can be really helpful with back pain. The open knee chest position can also help reposition a baby that is in an awkward position, or if it's used in, especially if it's used in very early labor. If you're feeling frequent irregular contractions, meaning they're happening frequently, but they're not happening at the same time, every time it happens, maybe 10 minutes, 5 minutes, 8 minutes, 7 minutes, and you're in between each contraction, but you're still feeling back pain and your cervix doesn't seem like it's dilating, or the hospital is telling you the cervix isn't dilating, this can be a really good position to be in. Be sure the buttocks are high in the air, like the picture, and you actually can be in this position for 30 to 45 minutes. As you can see in this diagram, the person has some padding underneath their knees. This really can help back pain disappear. What if your water breaks before labor? So what you want to do if you notice that the water is breaking, is the first thing you want to do is note the time you think that it broke. Sometimes couples are talking about it after it happened. The person's coming out and saying, maybe my water broke earlier. And you're trying to remember. So take note of that time. The next thing you want to notice is, what was the amount of fluid? Was it a trickle? Some parents talk about experiencing a pretty steady trickle or an intermittent trickle down their leg. Sometimes it's a leak of fluid, and a leak or a gush might be when someone, or excuse me, not a gush. A leak is when someone maybe changes position and more water comes out. And then they change position again and more water comes out. But if they stay still, nothing's happening. A gush of fluid is like an uncontrollable flow of fluid out of the body. You want to note that because that's important to pay attention to. Next, you want to pay attention to the color of the fluid. Is it clear? Typically it is. If it's greenish or brownish, that could mean that the baby has gone to bathroom or past their first bowel movement in the uterus, which babies sometimes do if they're distressed in some way. So that's important to note. And then you want to note the odor. Is it a body or sperm-like smell to the fluid? Because if sometimes folks have sex as a labor stimulating measure, or just because they were being intimate during that time period, and that's what's coming out of the body. So you want to kind of discern, because most of the time waters are odorless. If it has a pungent or strong odor, that's a sign that it could be infection. So time, amount of fluid, color of fluid, and odor, that is an easy way to remember. That is taco. That's what those letters spell. You want to note taco because what you should do if your water breaks is you want to call your pregnancy care provider, the hospital, or your midwife, and you want to let them know. Now, you might want to talk with your provider about this before you get to labor, before you get to in the third trimester or around 36, 37 weeks. Ask them, what's their policy? What do they want you to do if your water breaks when you're not in their presence? Some providers have a policy where if there's no medical concerns like group B strep or something like that, that you can continue to labor at home and that you don't need to come into the hospital right away. But they'll want to know so that they can be checking in with you and be aware that you might be coming in soon. Sometimes they'll allow you to labor for almost a day or a little more. Some folks are a little more conservative and they will want you to come to the hospital sooner than that, but you may be able to stay home. So you want to find out what your provider's policy is about this before this experience happens. Actually, most people do not have their water break during labor before labor starts. That actually is not a common thing. Maybe about one or two folks out of 10 have that happen. Although on TV, it happens all the time. So it's important to note that that's actually not typical for everyone, but it can happen. So you want to note taco if it does. So when should you go to the hospital or get settled in for your home birth? You want to pay attention to those feelings of contraction. Are they increasing in frequency, intensity, and duration? Frequency means, are they about 5 minutes apart or less than 12 to 15 contractions in a row for about an hour? Ask your provider, do they want you to follow the rule of 511 or 411? 511 means 5 minutes apart for one whole hour, or 4 minutes apart for one whole hour. The other thing you want to notice are the contractions feeling like they're lasting longer. Once they're lasting for at least a minute, then you know that that's a change that you should be probably considering heading to the hospital for. Also, the intensity. You're able to distract the birthing person somewhat easily during this phase. It might be noticeable. They might talk about, oh, I'm feeling another contraction, but they're able to carry on a conversation, watch a movie, eat dinner. If you're not able to distract them, or they're walking and then they stop in their tracks because they have to breathe through the contraction, or they have to use some sort of ritual or focusing technique or some deep breaths to get through, that's a sign that the intensity is increasing. So sometimes you need to get to the hospital or call your your birth provider sooner if the medical provider requests that you do that, or there's some medical concern that they've let you know. If you're a long distance from the hospital, you might want to get there a little sooner. Or if you have a history of previous births or labors that were very quick, then it's important to let your provider know and maybe get in a little earlier than this. Lastly, if you're just feeling a lot of emotional anxiety, it's a good idea to call your provider and let them know, even if you're not experiencing 411 or 511, but you just are worried and you're feeling very anxious and you would prefer to be in their setting. Another thing you could do is call your doula. This is a great time to let them know so they can prepare to start heading to the hospital and meet you there, or to give you some additional emotional support to help you if you're just feeling like you really want to go because of emotional anxiety. Of course, they're going to do what feels right for you and support you in that decision to go to the hospital if you feel that's best, but a doula's role is to support someone through emotional anxiety. So we will follow up and talk more about the further stages of labor in the ongoing sessions. I hope that this was helpful. Have a great day.